I'm presenting today on improving psychological health and safety in healthcare workers through technology-based support. We're really benefited in Eastern Health from our research department, which includes Charlene Record and Scott Taylor, who really helped us and guided us in measuring and really keeping on track of a research question and the things that would help us, I guess, move forward. Go next slide, please. Eastern Health employs approximately 13,000 people. Like many health organizations across the country, when this project was initiated and supported by NLWIC, we looked at engagement scores, sick leave, and absenteeism as really a common factor in healthcare work, and this was, of course, before COVID. We launched a 3-year project to develop and evaluate a chatbot, a way for employees to connect virtually to increase employee knowledge and uptake of psychological support services. Doing so was to develop, implement, evaluate the application and peer support function. And we want to assess how this affected employee perceptions of organizational support and psychological and safety indicators. We have signed on to the National Standard for Psych Safety in the Workplace and monitor its 13 factors. So those are important to us as we move forward. Next slide, please. Our research question is, will the use of technology to provide more accessible and timely employee mental health supports, including peer support, increase the organization's healthy workplace indicators? Next slide, please. The development in 2019 was quite extensive. We partnered with IBM to develop an employee virtual assistant. They worked with us virtually and also came to Newfoundland numerous times. Our employees really took part strongly in advising what were the top areas of focus for employee needs around mental health and psychological safety. And also, we're unique in the IBM world of a group that populated a chatbot with all the variations of what people might ask for in seeking support, whether it be stress or mental health or addiction or family issues, or you name it. We had thousands of pathways that we felt would be helpful. And we also had thousands of hours into refining that, including Newfoundland terms that the chatbot would recognize. The testers, as you'll see on the slide there, found the application easy to use. They would use it frequently. They felt the functions were well integrated, and they felt really confident in using that. Next slide, please. Our timing was impeccable. So thankful to have partnered with NLWIC when we did, because COVID arrived and we were able to launch in April of 2020. We had a peer-to-peer program in place. We had peer supporters ready. And at that time, with so many employees going home or being off-site and so much change, Eva, and by the way, you can scribble down the address there. www.checkwitheva.ca is the application if you want to take a look at that. Evaluation's been ongoing from, thank you. Evaluation's been ongoing from April to April, and that is both a survey of organizational perceptions of psychological health and also a built-in analysis within the chatbot itself. Thank you. Next slide, please. Colleague Maureen Brown, our coordinator, funded as well. And Maureen, if you're there, I'll let you speak for a moment on this is what the chatbot looks like. Maureen, do you have a second?
Yep, sure. So Eva it's hosted on a public URL. So as a result, it's strictly anonymous. There's no login. It's available 24/7 and regardless of location. And that was key because we have so many employees in a variety of areas, and often there's no psychological supports available. So Eva is, as I said, it's anonymous and it's strictly confidential. And one of the great things about Eva is that you don't have to know what resources are available. Eva is intuitive. You go to Eva and type in your problem, and Eva will present to you all of your options, whether it's in person, online, virtual, and also it's our connection for our peer support program. Another great part about Eva is it's flexible. and is very fluid. We can, depending on the current environment, for instance, COVID, we were able to tailor a section on EVA that had every resources available in regards with relation to COVID, and we can see what the demands are by the intents that the users are asking, or basically what the questions people are asking. One big thing that another great part about EVA is it's a central resource for all, it's a central hub for all of our resources. So communication is a big problem. Like a lot of people don't know where to find, a contact number for this, that, and the other. EVA has every up-to-date resource available, whether it's internal to Eastern Health, like EFAP, peer support, or employee and physician navigator line, or whatever. Or it also has all external resources such as Bridge the Gap, Doorways, Channel, and Janeway Family Center, anything that somebody may be requiring or looking for.
Thank you very much. Next slide, please. So we had our pre-survey that were conducted really showed that employees felt that they would use employee support programs when they understand what's out there. They understood and agreed that 53% that mental health support is provided by the organization. Next slide, please. And the other questions were around that people in the organization have a good understanding of mental health. They feel supported dealing with family issues. We provide support when critical incidents occur, and we provide tools. So those are really important for us to think about how we develop EVA and other resources. Those values are still coming. We're still not completed our program, our project. Next slide, please. Just want to show you some utilization data. There's been 12,713 total conversations since April 2020. The top three reasons for communicating with EVA are: one is looking for someone to speak with, informally or through counseling, feeling stressed, or general health concerns. You'll see the spikes in this graph are times when we launched and did promotions, but generally we're hitting about 800 or 900 visitors a month. The last dip at the bottom was a partial month. I checked with research yesterday on that. So, but for the most part, the use is consistent, and we'll likely do a new promo soon to do a boost again. But we've noticed that it's pretty active, and we get some feedback from folks when things aren't working for them. Next slide, please. Okay, thank you. I want to talk about opportunities. We were very fortunate. Not only did we launch EVA during April of 2020, we launched a suite of other services like rapid response teams, team check-ins, peer support, expanded peer support. And EVA allowed us to put all that out there to employees. So every time we spoke and sent an email, did a talk, we pointed people to EVA, and that became the central hub that really surrounded a lot of our services. It really was ideal timing. It also allowed us to look at what the needs are with peer support, one-on-one, but also peers as in facilitators helping peers. And that's helped us actually think a bit more about how we support our employees. And finally, we gain each month, we gain more and more knowledge about what people need and what people are asking for, and also what they need and they're not finding answers to, because we see that in the chat feedback.